who are not able to attend will be able to post this to the NASDAQ landing page that also houses the RFP and the project overview and some of those application resources. So fear not, there's lots of different ways to get this information about the RFP and this application process. So yeah, just appreciating everyone making the time and space today. It is really exciting to see over 250 people in this space right now, and expecting more. So we can jump into some brief introductions, but just to provide sort of an overview of where we're at, and for those of you who I don't know or haven't had the pleasure of meeting, my name is Laura Pegram. I'm the Director of Drug User Health over here at NASTAD. NASDAQ has had a drug user health program for just about 6 years now or so, and I was one of, well, the sort of inaugural member that built off the work of one of our dear colleagues and fellows who was before us there. So I just want to really note that this is a really exciting moment and a really exciting space. 6 years ago, 5.5 years ago, I don't feel like we would even be anywhere near where we are right now in terms of increased resources going into programs, syringe access programs directly. And, I want to acknowledge, I feel very honored and grateful that NASDAQ and our project partners have been, given the responsibility and stewardship of these funds and getting them into programs and communities, getting them to you all who are doing the work and doing the work just in an incredible way, in a tenacious way, in a heart-facing way, in a way that is, we know is incredibly effective at reaching people who use drugs. So I just want to acknowledge, we all as projects, as NASDAQ staff, Vocal and UW have been awarded and given this incredible honor to get these resources out in community, but this builds upon 20, 30 years of community advocacy and pushing and really tending our federal partners, our state partners, our community partners to understand and really recognize the importance and value and just incredible work that you all do, both on the ground and in terms of advocacy. So, like I said, we're really excited to play this specific role. And yes, just really excited to get money and resources into community for you all, because y'all been doing the work for a really long time and very tirelessly. So I just want to acknowledge that, appreciate you all, and yeah, we'll jump right in. So we are currently searching for a cooler name than this, probably, but this project, is really about getting money into community, really bolstering your capacity to provide services, and this is direct program funding. So before we get too far into the overview and background, today overall, we're just going to kind of do a walkthrough of the RFP and go into the background of this project, where sort of the resources have come from, and then kind of walk through all the components that are outlined in the RFP. And then we're going to also walk through the application platform and process and leave a good bit of time to have some real Q&A, and really just answer whatever questions are coming up for you all, hear and address hopefully any concerns that are coming up, and yeah, just excited to make this as interactive as we can. We very intentionally set this up as a meeting so that folks, when we get to that Q&A, can use their voice as opposed to the annoying little chat box thing. But if there are questions that are coming along throughout, we do have folks on staff who are keeping track of questions as they come in. So if there's at any point we need to pause and answer specific questions, we can do that as well. Good, great. Allison, can we go to the next slide? Just a little background about NASDAQ for those of you who are less familiar with us at this point. So NASDAQ is a really pretty wonky acronym that we rely on the acronym because the name is no longer incredibly accurate. The original name that we technically operate under, but NASDAQ is an acronym that stands for the National Alliance on State and Territorial AIDS Directors. And there's lots of reasons, like I said, embedded in that name, that we just do more work than that. We work with all the US state health departments, their HIV, viral hepatitis, and increasingly drug user health programs. Our primary core membership are HIV coordinators or directors at the state and jurisdictional level. This is also, extends to all the US territories, the District of Columbia, and all the CDC funded jurisdictions, those places many of you are probably from or know of, the places that are large enough to have, equivalent populations as many smaller states or lower prevalence states. And so really thinking through, how we work with health departments across these complicated and interconnected health systems. And then, our drug user health work has always been both grounded in supporting health departments to help support you all on the ground, but also increasingly over the past many years, being able to provide technical assistance through the National Harm Reduction Technical TA Center that is CDC and now SAMHSA funded. To programs, any program on the ground, any syringe access program or any individual looking to start up services or just learn more, about harm reduction. So we are, incredibly excited to bring this new opportunity to you all and go through, and just walk through it here today and kind of lean into just what a unique and special moment this is. So I feel like we can probably go to the next slide and I'll pass it over to, I just put on our pretty faces. Sorry, so just also for familiarity for you all, the drug user health team at NASTAD has grown really substantially over the past many years. Just kind of for some environmental awareness, like these are folks who you probably have heard their names, gotten emails from them, who will be assisting with technical assistance for, related to this project through the TA Center. And then if you want to go to the next slide, we do have some core staff that are present here on the call today who are going to be doing a bit more of the work directly related to this project, including our amazing grants and compliance team who are going to help all of us get in better shape and as programs and whatever, provide capacity building assistance to, help us all better understand what those complicated needs are around, any potential like auditing or reporting requirements. So glad to pass it over, I think at this point, to our friends at Vocal. Zach.
Yeah, thanks, Laura. Hi, everyone. I've just been watching the going through the participants, recognizing so many wonderful people, and it's really nice to be in space with some of y'all again. Some of y'all I haven't shared space with for a while. But for those who don't know me, my name's Zach Ford. I use he, him pronouns, and I'm the Managing Director of Strategic Growth at Vocal New York. There are a lot more folks from Vocal who will be working on this project, helping out with some of the capacity building work. But we just moved into a new building. And so they're all working on getting our new drop-in center set up and running so that, because our participants are they're coming in, it doesn't matter. So we're getting all that set up. So I was selected to come here and be with y'all today. But just a little bit about Vocal. So Vocal New York, we're based in Brooklyn. We started out back in 1999 as the New York City AIDS Housing Network. And we were founded by 3 people, Joe Bostic, Joe Capistani, and Jennifer Flynn. And really, we were originally founded as a community organizing group. And so our first campaigns focused on housing and support for low-income people living with HIV and AIDS, expanded syringe access program legislation, and also the Parolee Human Rights Project. So today, Vocal New York is a statewide grassroots membership organization that builds power among low-income people affected by HIV and AIDS, the drug war, mass incarceration, and homelessness in order to create healthy and just communities. So we do this through a lot of different things. We do community organizing, we do leadership development, We run advocacy campaigns. We also have direct services and do harm reduction services in Brooklyn. And then we also do participatory research and direct action. And if you go to the next slide, I'll share a little bit more. So we run like issue-based campaigns. We provide direct services to people who use drugs. Our model of movement building draws inspiration from 3 traditions. So that's traditional community-based organizing, direct action AIDS activism, and Black-led social movements for social justice. And things that we've recently accomplished here in New York, things like repealing Jim Crow era prison voting bans for people on parole in New York, removing prior authorization for medication assisted treatment for New Yorkers enrolled in Medicaid. We decriminalized all syringes in New York last year, something that we've been fighting for 11 years. We also legalized marijuana in New York last year. I say we, I mean, you know, part of coalitions we were part of. But we're really proud of our marijuana legalization bill. It's very much grounded in economic and racial justice. And actually, like the first license was just announced yesterday for a group up in Harlem to open the first dispensary. We also secured a guarantee to provide MAT in all New York State prisons and jails last year, which was super exciting. So you can kind of see that like our 4 core issue areas really are intersectional. A lot of it has to do with like ending the drug war, but it also has to do with HIV and AIDS, homelessness, and mass incarceration. But like I said, we're also a harm reduction organization, which is what brings us to partner on this project. So we provide direct health services to people who use drugs, mainly in Brooklyn. We operate our brick and mortar drop-in center in the Gowanus neighborhood, but then we also do mobile exchange at sites around the borough. And we do very traditional stuff like syringe exchange, distribution of sterile supplies, including injection, smoking, snorting, overdose prevention training, naloxone distribution, all that stuff. Our new drop-in center has some really amazing things that we're super excited to roll out. So it's very much like a space for our participants, and we own the space, which is really exciting. We got like gentrified out of our last space in Brooklyn. And so like they can't get rid of us this time, which is super exciting. But we have laundry facilities for our participants. Most of our participants, they come in, a lot of them are homeless. And so we have laundry facilities. We do like cooking and meal prep and are really looking at ways to have kind of like sustainable food resources and stuff for our participants. We have bathrooms and showers that people can come in and use anytime. We do, you know, weekly support groups. We have a computer lab where people can like search for jobs and apply for housing and stuff. But then we also do things like mental and emotional wellness. So we have regular meditation and yoga classes for our folks. And then Mount Sinai, which is a pretty large hospital system here in New York, they've co-located a clinic within our drop-in center. And so we have a full-time nurse practitioner, and she does, you know, basic first aid for our folks, but then also buprenorphine induction. And then we also test and treat for hepatitis C on site, and then make referrals as needed. So we're so excited to be a part of this. We're really, really grateful to NASTAD for reaching out and wanting to partner with Vocal. And I mean, we've been doing this work for a few decades, and we're just super excited to be able to share some of our knowledge with organizations around the country. So thank you.
Yes, thanks, Zach. It is a pleasure to have the opportunity to work with you all, and I'm just really excited for exactly that reason, for Vocal to be able to share expertise and knowledge, experience with programs across the country. Yeah, this means y'all get tied to us for 5 years. Anyway, we haven't gotten to in such a good way. So let's go ahead and jump over to our evaluation partners, other project partners at the University of Washington. I don't know who's speaking. Hi.
So my name's Brittany Price. I use she, her pronouns. I'm excited to be here with y'all today. I work with the Supporting Harm Reduction Programs team at University of Washington, and the other folks from the SHARP team that are going to be supporting us in this evaluation work are Sarah Glick, our principal investigator. She heads up a number of harm reduction focused projects in the Seattle area in Washington. And then Kelly Knutson, who's on the call today. She's the TA project manager and also provides technical assistance to SSPs. Kelly and I are both based in North Carolina. and I'm a TA provider as well. Overall, our work focuses on working with harm reduction programs and developing, implementing, and sharing results from their own internal monitoring and evaluation systems. And for this funding, we are going to be leading the evaluation process. So essentially just measuring whether this whole grant is doing what it aims to do.
Awesome. Thank you, Brittany. And Brittany and those folks, you set me right up, right? What this program aims to do, it's pretty simple, which is part of what's so great and innovative. And it shouldn't be innovative necessarily, but it is. We aim to get a whole lot of money into community, into syringe access programs and community-based harm reduction programs. And I'll get into some of the more specific details. Some of this will be a little bit duplicative in these couple of slides, but yeah, we, first and foremost, want to get low threshold direct funding into syringe services programs, through a transparent process that we are creating and developing right now, that really prioritizes programs that have limited options and resources available to them, that have experienced or are experiencing extreme health disparities, really representing a diversity of program size, from the small, scrappy collective folks up to, you know, whoever else is able to, you know, be prioritized, and really just thinking about geographic location and just a real spread of programs, right? We want to get these resources into community and have that be meaningful. The second main component of this overall is that we are deeply committed as an organization and have a big component of our approach to this work about trying to provide opportunities for capacity building assistance around compliance and fiscal development and some of those like really kind of, you know, in the weeds things that I'm, being a social worker, you know, never thought I'd need to know the most about, in terms of audits and timesheets and, you know, financial documents and require, you know, that type of those type of requirements, and really, you know, helping both, you know, programs that we select, that we fund, but also creating resources that will be broadly useful to programs across the country, right? Really acknowledging that the, you know, we're on a trend here. And I firmly believe that more and more federal and, you know, complicated, well, hopefully not complicated, because we're going to prove it doesn't have to be complicated. Federal and state jurisdictional resources will go, are going to be going into syringe access and syringe services programs over the next many years, which is long overdue. And again, just really excited to be here today. So if we want to go to the next slide. So just a little background about where this comes from. NASDAQ and our project partners, the University of Washington and Vocal New York, were funded under a two-component notice of funding announcement or opportunity that was posted early in 2022. We were officially funded for the second component, which is related to funding. It's just called funding. But we are extremely excited that they were able to make these resources available and just, you know, recognize the importance and centrality of programs. Component one also is not a focus of today's webinar, but is related to a component dedicated to supporting a national network of syringe services programs through an annual survey and building out sort of the network of SSPs that we know are out there in the country. That was awarded to RTI International, as well as I believe their project partners NASN and the National Harm Reduction Coalition. So excited for alignment between these two components. But today, let's talk about money. So this is a 5-year cooperative agreement, and in this first year, we anticipate getting $6 million out into community, into syringe services programs. So I get chills every time I say that. It happened again just now. We are going to get $6 million in grants out into communities, out into community-based programs, syringe services programs across the country in year one. Again, this is a 5-year project. The number of awards that we're anticipating in year one, we estimate between 40 and 80 Syringe Services Programs awards will be funded. This can be used for general operating capacity, including supplies, infectious disease, prevention services, immunization, outreach services, overdose prevention efforts. And we'll go into this a little bit more about what is allowable and not. I'm sure there's questions. There's no, yes. So we anticipate oh no, go back. Too fast. We anticipate the range of funds awards. Oh yay! The range of awards to be between $50,000 and $150,000 for the first year. We anticipate that we are going to make. Technically, we can only make 1 year awards at a time, but given making sure that so long as we anticipate the total funding period to be a 2-year overall project for the syringe services program selected in the first year. What is a little tricky about this, and we can certainly go into this in the Q&A and offer any any type of insight we have, is that because these resources come from appropriations that are meted down to the CDC and other federal agencies. Well, this is just funded by the CDC. Well, it's funded by NASDAQ. We got the funding from the CDC. It is unclear how many resources we'll be able to get into programs in year 2. So the year 2 awards might vary dependent upon how much we are able to receive and get into community. That we would anticipate and hope for at least the same amount in year 2, but there is opportunity and additional opportunities for, say we got more, that resources that we could get into communities in year 2, then we could create additional an additional RFP process for additional programs to be funded. But if you're selected in year 1, anticipate a 2-year project, and you would not have to reapply to that question there. So I'm sure there will be questions about that, but let's go ahead and jump to the next slide there. So just kind of running through things that are written out in the RFP. This is cut and paste almost exactly from that. But really, these resources can be used to support a whole range of SSP activities. These are just some examples, not limited to this. Thinking about capacity and organizational infrastructure through staffing, benefits, healthcare, health insurance, also behavioral health insurance and all of that, organizational overhead, paying some rent, rental, SSP site or mobile unit rental or modifications, purchase of supplies, safer drug use and SSP supplies. And there's a real caveat here that this is a pass through federal resources. So this has to be in alignment with current federal allowability, which we can also go into later. But, so long as that syringe ban is in the Appropriations Act, syringe direct injection equipment, syringes and cookers at this point cannot be purchased. And we will keep folks updated about what ends up within the actual continuing resolution as it speaks to smoking supplies, glassware, stems, that sort of thing. But we'll also have years to advocate for the importance of getting those regulations changed. So deep commitment to that too. Okay, so other things, obviously, distribution and disposal of syringes and safer use supplies, testing, treatment, linkage to care, services related to infectious disease, and wound care, things like that. Let's see, referral, navigation services for MAT, as well as a range of other referrals and comprehensive care services that I know you all already do, and distribution of overdose prevention supplies. Is the last one we listed out, but just to note, this is not limited to this list. Ooh, Phil, let's talk about that. Okay, so I feel like I'm gonna pass it over to Sharday, I believe, or is it still me? Let's talk eligibility.
Can't hear you, Sharday.
Oh no.
Can you hear me now?
Got you.
Yeah.
Okay, perfect. All right, so I'm just going to talk a little bit about our eligibility requirements here. And as Laura really talked about before, we're really focused on trying to keep this RFA as low barrier as possible. So with that in mind, here are the 3 eligibility criteria. So number 1, you have to be located in a jurisdiction with a determination of need from the CDC. Number 2, you have to have status as a tax-exempt 501c3 nonprofit or a fiscal sponsor willing to receive federal funds. And then 3rd, we are looking for programs who are grounded in harm reduction practice and principle and are also distributing safer drug use supplies. So those are the 3 eligibility criteria. A couple of resources / considerations around eligibility. Included in your application materials, there is a link which will help you to confirm if you are indeed in a jurisdiction that has a determination of need from CDC. Another thing is to really make sure that you are in conversation with your potential fiscal sponsors around their capacity and availability with federal funds. And then finally, if at any time throughout this process you have questions about your eligibility, please feel free to reach out to us. We are happy to talk that through. We want, as Laura said, as many dollars to get into community as possible. So don't discourage yourself out of applying just off the bat. If you're unsure, please reach out and we can talk about it and get any of your questions answered. So moving on to some of our funding priority considerations. Ultimately, we really want to ensure that we're funding as diverse a cohort as possible. One that is really representative of the spectrum of communities and harm reduction programs that are experiencing and really responding to a myriad of intersecting issues across this country. So these things on the screen here really give you an idea of some of the things we'll be thinking about as we work to make selections with the cohort. So we really want to make sure there is diversity in geographic setting, program size, structure, population served. That means that we don't want clusters of programs just on the coast. That means that we're looking for programs that are small and new, as well as programs that are larger and more well-established. We understand that the work looks different across the country, and we want to be mindful that the cohort is really reflective of that. We're also thinking about communities and populations that are experiencing things disproportionately. So that means higher rates of Hep, HIV, overdose, and other conditions related to drug use. That's U.S. territories and tribal nations that are experiencing current and historical health disparities in some of these same categories. We really want, again, to be thinking about diversity in a lot of different components and spaces. So these things here are just giving you an idea of the levers that we're looking to pull, the things that we're going to be considering when we're really trying to create this kind of really reflective, comprehensive, rich cohort. Next slide. So we talked about kind of our overarching priority considerations, and I want to deep dive a little bit more granularly because in light of all of the things that we've just discussed, we want to make sure that prioritizing means like extra points will be delivered. We want to make sure that we are really putting our money where our mouth is, and that means that we are really making sure that we're going to recognize the importance of historically marginalized populations and their intersecting histories, and the impacts of criminalization related to drug use and all of these different issues. And we want to make sure that we are working with agencies that are working with these populations at the top of their radar, that are working with these issues at the top of their radar. So SSPs and harm reduction programs that can exhibit their reach and their focus on these unique populations, or these kind of unique program models that focus on these different populations will be prioritized in scoring through the application process. So we really wanted to make that explicitly clear. It's not just that we want to make sure that we're going to have a diverse cohort, and we just want to consider making sure things different priority populations are served. We want to make sure that we are taking into account a lot of the history and the actual infrastructure of how we score and respond and assess these applications. So that means that some extra points will be distributed across these categories. So that's it for me today. And I'll kick it over to our partners to tell you a little bit more about our evaluation plans.
Yeah, thanks, Sade. So switching gears a little bit to talk about the evaluation for this grant. What are we talking about when we talk about this evaluation? Essentially, we are talking about measuring how well this overall funding opportunity meets its goals. So we're trying to find out if this funding increases easily accessible resources for harm reduction programs, and whether it increases access to harm reduction supplies and services for SSP participants. And in order to learn how well this overall project is working, we're going to need some data from grantees throughout the grant period. Next slide, please. So this means we will be asking for regular reports and check-ins from the programs who receive funding, most likely in the form of some monthly surveys and quarterly updates. We'll be asking for some program data at those time points, especially any changes and updates that the program has made recently. And we'll ask for some encounter level data as well. So things like services delivered, supplies distributed, and referrals made. And we'll focus on data that many programs are already collecting. And altogether, this data is going to give us a picture of how the funding impacts programs over time. Next slide. And so as we build out the plan to collect data from grantees, which is still very much a work in progress, we are keeping a few main principles in mind. So we want this whole process to be as flexible, easy, useful, and supportive as possible to grantees. And to that end, our reporting processes are open to shifting depending on what each program needs. So for example, some programs might find that it's easier to give quarterly updates as a written survey response, but others might find that checking in with a focus group ends up being a better fit. And since we anticipate that each program is going to offer different services and record them in different ways, we want to note that not every program is going to report out on all of the measures that we're going to have. So we plan to tailor our questions to grantees as much as possible. So in other words, we're not going to be asking folks about hepatitis C testing if that's not something that their program offers. And we also want to be sure to ask for data in ways that programs already collect it. So we know that programs, for example, track encounters differently, right? Some programs are going to have data on unique participants, which might allow them to report out how many new participants they've seen in the last quarter, while others are going to have more encounter level data without information on how many different individuals came in. So we'll be asking them to report data based on encounters, not on unique individuals. And we want to have this process work with the systems that programs already have. We also want it to be as low burden on program staff and participants as possible, which is another reason that we hope to match our measures to what programs are already doing. And programs are going to be able to enter data for each report into Foundant, which is the same platform that the application is in. So you will be seeing that in just a few minutes, I think. And we hope to make reporting as useful as possible for grantees too. So we want the data that we want to be able to turn all of the data that programs are reporting, or a lot of it at least, into tools that they can use beyond this project. So right now we're thinking that that might mean creating data dashboards that can make applying for other funding easier. And we're eager to make sure that this process benefits everybody involved. And finally, we want to support programs throughout the process, and we'll work with folks to make sure that they're real clear on what data to report and how to report it. And we welcome feedback at all points of this process. So we want to make it work for programs as best we can. Yep, and then next slide. This is a picture of what we have so far for the evaluation plan. We want to emphasize that this process is not punitive. So in other words, again, we're not using this work to check up on grantees. The purpose of the evaluation is to see how well the overall funding opportunity is meeting its goals, all of which come down to increasing funds, increasing supplies, pushing more resources into the hands of the people. So while this plan is very much a work in progress, we know that we plan on updates at a few different time points. Once at the start of the grant, so that's mostly going to be confirming or updating baseline information from the application. It'll give us a picture of where programs are starting, and it'll make it easier to see and celebrate change along the course of the grant. Then we'll have a monthly survey that'll mostly be numbers from encounters, and then a quarterly report, which for some programs are going to be a survey, for some it might be a focus group or a listening session, depending on what works best. And that'll mostly record program changes, capacity updates, things like expanded hours or staffing or new services. And we're also hoping in those sessions to learn more from programs about how we can improve our own processes and get a better idea of how low barrier this funding actually is. Next slide. And then as we wrap up, there are a few resources, or as we wrap up the evaluation section, at least, we wanted to share a few resources. One is a webinar that the UW Sharp team did with AIDS United and NACHO on how to find, collect, and describe data for grant application. And then Laura, did you want to describe the
Yeah, so thanks so much for that, Brittany. And yeah, so these other resources are actually listed also in the RFP and on the landing page. These one NASDAQ worked through the TA Center to put out guidance, kind of a guide on grant writing tips, tricks, writing, which also includes a lot of data sources in, I don't remember what section it is of that. So that is linked there. And we worked with the fabulous Catherine Swanson and the Balanced Imperfection team this last year to create the Harm Reduction Hacks website, which also includes a solid section on grant application tips, tricks, things like that. So, and that is grounded from community experience and perspective. And it also includes a good amount of information about some of these fiscal and organizational elements that are being asked about in the chat related to things like a DUNS number and fiscal sponsorship and considerations around those things. So we are able to provide TA on those elements kind of through the National Harm Reduction TA Center to make sure people are in the right place, to be able to successfully apply. And I'll just tack on with, second, so much of what Brittany went over. I think one of the real nice things about the way that we, nice things about the way we've structured and tried to approach data and evaluation in the past is that there is real flexibility here, right? We don't expect you all to collect the exact same data. We know that we know that systems differ and different data points, data collection methods differ, and there's real flexibility to shift course. Like if there are times when like a typed qualitative report, or like on successes, challenges, lessons learned, if that feels like too much, like maybe we should as a cohort have like a big focus group or listening session, ways that we can help ease that data collection burden. And we do have some real flexibility in structuring those things differently as we move forward in the project. So I am excited to see the creative ways that we can help take and ease some of that potential burden. Yeah.
Sorry, Laura, you can plug this if you want to. I was just going to plug our work with the National Harm Reduction Technical Assistance Center. The Sharp team is part of a great group of collaborators, including NASTAD, offering free on-demand support to harm reduction programs all over the US. You can reach the TA Center through the form that's linked here. And then you can also reach out to the UW Sharp team directly for any monitoring and evaluation questions that you might have, including helping figure out how to report data to funders, including maybe even for this grant.
Yeah, thank you so much, Brittany, and our UW partners. So speaking of this grant, right, how are we going to select who of this amazing community and these strong programs represented here today and folks who are watching in the future while we recorded this and put it up on the landing page? So how are we going to do that? Well, you know, as has already been said, this is just step one in this very new and very exciting opportunity, and we're actively honing and perfecting our processes to ensure these grants are accessible to those who are doing the work and to prioritize actual harm reduction services where they're needed the most. So as y'all saw in some of our earlier slides and through the presentation, we have a really strong team of drug user health folks here at NASTAD. We also have incredibly strong partners at UW and Vocal, Vocal New York, Vocal Worldwide. And within our NASDAQ Drug User Health Services and the National Harm Reduction TA Center, we also have a really amazing team of regional consultants who many are embedded in communities and programs providing harm reduction. So we have a lot of folks that we're going to be tapping just in-house, but there's also likely going to be opportunities for folks from outside to volunteer if that's something that you're interested or have capacity in. We will be sharing information on that as we go. And so, you know, again, we're committed to funding a wide array of syringe service programs from across the spectrum of underground and small programs, scrappy programs, to big, large institutions and integrated programs. But our priority is really on those who have a demonstrated history of providing these services. Right. And so, you know, some of the things to consider when you're preparing your application and we'll be considering on selection is those letters of support. And those can include partner support and referral service organizations, community stakeholders, and other community leaders. This is something that we really want to have access to so we can see your place in the community and the services you're providing. Also, again, you know, the demonstrated ability to implement SSP, as well as meaningful engagement of people who use drugs. And that is something that we want to see throughout your program, including executive leadership. Also, you know, when we're talking about building meaningful relationships with participants, we're especially focused on those with historically marginalized or stigmatized within mainstream healthcare and services. And then, you know, we also would like to see a commitment to building and maintaining community partnerships to increase the services you're referring to, whether that's adult vaccination or other care services. And so additional selection considerations that we want to highlight, right, is that meaningful engagement, not only of people who use drugs, but of people of color and other historically and disproportionately impacted communities. And, you know, that dedicated and demonstrated ability to reach larger and priority populations. So with that, I'm going to wrap up this section and transition over to my colleague Meredith so we can talk about the application process, because I'm sure a lot of y'all are on the edge of your seat saying, how do I sign up? How do I get involved? How do I get on that list to be selected?
Thank you, Allison. Can you guys hear me? Okay, so yes, we're going to go through a quick walkthrough of what our online application portal looks like. Before we do that, I'm just going to run through a couple of things to keep in mind as you're applying. So to start your application, you'll need to register for an account with the online portal at the link that I'm dropping.
Oh, Meredith, you're muted. Sorry.
Yeah, Meredith, you went on mute.
Oops, sorry. I'll pick up where I was. Yeah, I just dropped the link in the chat to the online application. So you have to register for an account there. And I want programs to know that this software is used to power application portals for other funders. But even if you've used this platform or have an account with this platform for other opportunities, it will not carry over for this opportunity with NASTAD, and you'll have to make a new account. But that account will be valid for all future opportunities with NASTAD. So in the registration, we ask for pretty basic information about your organization, such as your address, your phone number, your primary point of contact, your employee identification number, and your DUNS, which I've just learned is now called UEI number. If you don't have a UEI DUNS number already, you'll need to register for one at www.sam.gov to be eligible for this funding. I think, as my colleague Courtney said in the chat. And if you need help figuring out how to get this done for your organization, please reach out to DUH-grants@NASTAD.org, as this is within the scope of TA that we can help to provide to help you all get your applications in. We really recommend looking into getting one, because if it not only makes your program eligible for this opportunity, but for other federal funding opportunities in the future. So after you've made your account, you should get a confirmation email with a link that will lead you to the logon page. And that email will come from administrator@grantinterface.com. Once you log in, the RFP should be the first thing that you see. And I think, Allison, if you're able, could you share your screen? Okay. Almost there. Okay, so when you, I have really bad eyesight. When you log into the page, this should be the first thing that you see, the application for this funding opportunity. But if not, say for some reason, Allison, can you press home? The little house on top. That's your login applicant dashboard with all the information about your organization. But if you want to get to the application, you click apply in the upper left-hand corner. And then it will bring you to this page, which is like an abbreviated version of our RFP. We recommend that you read through this abbreviated version, but also through the full RFP that is on NASTAD's website. So when you've finished reading all that, you can click apply on the upper right-hand corner. And that will bring you into the application itself. Oh, I forgot to say, before you click apply, there is a preview button in the lower left-hand corner on the cover page. So you can go through all the questions before you actually start your application. Sorry, Allison, thank you for catching up with me. So yes, if we go back into the application, I'm not going to go through the whole thing because there is a PDF version of the RFP on NASTAD's website, but I just want to show some features that we have in this portal. So there you can see that the application is divided into sections, and each section is collapsible. So that allows you to skip around if you would like. It also just, yeah, it just allows for some flexibility in how you fill this out. We've structured the RFP to be kind of like a short essay question test. So rather than a long 12-page essay, it's like short answers on a test. So there's word limits and character counts on each question, and the system will automatically track for you how many characters? Yeah, characters, not words. How many characters you have left. And the system also auto saves every, I think, 200 words. So you don't have to worry about losing your progress, and you can save the application and come back to it later. You don't have to finish it all in one sitting, which is good. I think that is all I have to add on the actual system itself, unless you have anything, Allison, and then we can get into the attachments. Okay, so this slide is just about the last section of the application, section E, that is going to ask you to upload a bunch of different files. The application budget template should be within the application budget template, and the organizational representation table are both downloadable from the application portal, but they are also on NASTAD's website in the landing page for this funding opportunity. In addition to the budget and the organization representation table, we'll be asking for your IRS 501c3 determination letter, your most recent audited financial statement, copies of your organization's financial policies and procedures, and a list of your organization's board of directors or that of your fiscal sponsor. We understand for that not all programs will have recently audited financial statements. So if you do not have them at this current time, you can still apply. We just ask that you maybe submit a brief explanation of why you don't have one as of yet and plans to get one in the future. I think if you don't have one, you could still be awarded the funding. And if you are, you'll just be expected to come up with an audit within 6 months of the project start date. I think that is all for me. Or actually, sorry, next slide. So we're just going to go over some dates of importance for the RFP application. So the release date was on Tuesday, November 29th. The due date is Friday, January 20th by, I think, 11:59 p.m. or something Eastern. The estimated notification date will be February 21st, and the award date or the project start will be March 1st, 2023. Now that is actually all for me.
Great. Well, thanks so much, Meredith. And yeah, I mean, I feel like unless the team has any other, do you want to just, I mean, really just, oh, sorry, go back to that last, I'm deep in the chat here. Hold on. I mean, really just summary. We are all just incredibly excited to be getting these resources into community. This is long overdue and so well deserved. You all have been doing the work and you know, really just so incredibly important, and we're really honored to be able to work with you all moving forward. Yes, I mean, this is a big day. I feel like we should all lean into just how much work over the years has taken to get to this space, and we are committed to doing this right, you know. So glad to have, you know, space for answering questions here, but taking feedback as well throughout the life of this project. And yeah, I think without further ado, we can kind of open up for questions. I've definitely been trying to keep track in the chat. And it feels like some of the, so one of the questions that I haven't been able to get to yet is, let me see. So is there a specific budget cap for organizations? No. Well, I mean, 150. The range that we are anticipating is between $50,000 per year and $150,000 per year. These are low threshold grants or subawards, awards that will come out through NASDAQ. We are anticipating, and this is described in the RFP, you know, that you will be able to receive chunks of money, several months of money at a time. Full disclosure, it will take us a bit of time to get these contracts all in place. So programs that are awarded can anticipate we're hoping for, you know, if our timeline is on track, a March 1st contract, you know, subaward to start then. And then, you know, throughout the month of March, we'll be able to get the contracts in. So programs who are awarded should be able to, should anticipate needing to cover some costs up, you know, for that first period of time before we can get the money out. Let's see. There is a template for the program SSP budget. I feel pretty ambivalent about the organization's current annual operating budget, if that is in addition to your SSP budget. If that looks slightly differently, that in my opinion is okay. You don't have to try to fit if you're a larger organization with an SSP housed in there, yes, you're allowed to use your own budget there. So government agencies are eligible based on the criteria. So in the RFP, there's a bit more detail around this, so please review that. We are open to funding syringe services programs that are couched within a diversity of different types of organizations, thinking through federally qualified health centers, AIDS service organizations, health department run programs, and yes, that is allowable. There is language in there about the range of folks who, or range of spaces where programs can be couched, basically. Okay, let's see. An application focused primarily on getting naloxone out into the community with referrals to SSP services. We are really trying to fund programs who are giving out safer drug use supplies. So, you know, be thoughtful of that and keep that in mind in terms of your application and how you are communicating, you know, the need in your community as well as the gaps in your community. But that is our intention with these resources. Let's see, if a current audit is still pending, can we submit the last one in the meantime? Sure thing, absolutely. State government health department org. To my knowledge, there are no states that operate a syringe services program, but local and county health departments, city health departments who do are eligible to apply. Whew. Any others that I'm missing, folks?
I think we're collecting some questions in the chat, so would it be helpful if we kind of feed them to you, Laura?
Sure.
Cool.
Let's see. I'm seeing who will we be able to purchase. Will we be able to purchase syringes with this funding? No. So this funding is pass-through resources from that are required to follow what is currently language that is currently restricting the use for direct injection equipment, which has been interpreted as syringes and cookers, and most likely pipes and stemware, but though we still have, that is still yet to be completely determined in the federal appropriations space. So for now, until we can get that language out of the appropriations funding, yes, syringes that are used for direct injection of, and here's a point actually of clarification, direct injection of illicit substances, of illegal substances. So IM syringes would be allowed if it's for naloxone or for hormones or for any other valid reason. It's really just that prohibition is often misunderstood, just as a caveat there. Yes, and no, there is no cap on how much an organization who's applying can earn to apply. We don't have an upper tier there. So the purchase of a vehicle is a fascinating question that we have really gone into in great detail with past funding opportunities and demonstration projects that we've put out through NASTAD with a variety of organizational partners. It is easier with these types of resources for an organization to rent a vehicle. We can go into that more specifically on individually, and also this is some of the like organizational, like the touch points between Vocal, us, others, that we are committed to helping figure out the best case scenario, you know, in terms of getting a variety of program costs, including vehicle rental or mobile unit outfitting. You know, we're committed to helping figure that out. So can organizations request startup funds? It sort of depends on whether syringe services are embedded in the application. Certainly, we would not discount an application that includes a proposal related to startup funds. So keep that in mind.
Laura, could you address if we can fund the salary of an employee who is passing out syringes?
Oh yeah, totally. Salary is you know, salary, overhead, the space, the outfitting for a mobile unit, rent for your office or your drop-in space, all of those are completely allowable, encouraged. Also strongly encourage getting salary and benefits and, you know, all of those things. Yes, to the folks that you are working for with.
How about
mm-hmm.
Oh, sorry, I was going to say, just how about having some programs will be able to help fund like participants doing like day work and being able to give them gift cards or like stipends or something.
Yeah, great.
Awesome.
Laura, can I relay a couple of lightning round type questions from the chat?
Sure.
Can we purchase Narcan with this money?
So this is one space where right now we are still working to get a definite answer from our federal partners. Generally with this, where this type of money comes from the CDC, purchase of medication is not allowed, though it is a space where we are still hoping to advocate on as throughout the life of this project. So we will have a more definite answer by the time we are able to, make actual selection, but and we'll post that once we get a definite answer on the landing page.
Well, how about cash stipends for participants?
Stipends. So cash stipends, there is a process and protocol related to the documentation and the reason for such use of stipends or incentives. And so there is opportunity to do that, but there's also some requirements about extra documentation that might be required. And the reason for bus passes are definitely allowed. There are also gift cards.
Hang up, I'm on a call.
Oh. There are also some creative strategies that we have worked with programs on in the past to get more money directly into, in terms of incentives to participants directly. Phones for participants, I believe, given the, the right type of framing around that, would be allowable. Fentanyl test strips are allowable.
From Lauren Kestner, payment for RN or FNP hours?
Yes, I believe so. That is one that we should earmark, as well as the naloxone, to get clarification to put on the website, but yep.
How about for like community food, like at events, a lot of funding will restrict food.
Yeah, no, there's no, I mean, build it into your, yep. That should be allowable.
Oh, wow. That's awesome. In our tribal communities, it's always hard when we try to have gatherings and then there's like funding restrictions on food.
Yeah, I mean, I think so long as it's within reason, it definitely makes sense, and describe some of the, why it's included there, but yes.
Awesome. Thank you.
Yeah. I'm having a hard time following now, everyone. Others feel free to jump in.
I guess I'm asking about the audit again. So every single organization, hi, how are you?
Hi, good, how are you?
I'm good. Sorry,
Good.
I'm actually in Arizona right now.
What?
Arizona people. Yeah, my question is about the audits. Am I hearing that every organization, regardless of their budget, will have to have audits? Because, yeah.
Yes.
Okay. Are there cheaper options than like $10,000 for an audit?
So
Our budget right now is like $15,000 total.
Yeah, I mean, I think thinking through options in terms of fiscal sponsorship versus 501c3, or potentially partnering with other applicants from that jurisdiction or state might be an option. The other thing to consider about audits, I mean, as organizations grow, that, like when you submit a budget and create a budget, audits and some of those administrative things organizationally should be built into your indirect costs. So for such a small organization, Chris, I'm not sure we can touch base, about specifically. And again, like Meredith had said, if a program has a very out-of-date audit or is brand new to the 501c, if they don't currently have one, those subawards will just include some contingency language around like this organization commits to explore, to getting that documentation in line within 6 months, and that type of resource, that type of line. So
okay,
Can
interject in here, Laura. This is Courtney Smith. I am the Grants and Compliance Manager here at NASTAD and working with this amazing team bringing this to you guys. But for the audit, they're really expensive, and I absolutely understand the barrier that creates for a lot of programs. We would just ask that you provide your financial policies and procedures, show us that you have a system or software in place that can accurately manage the funds that you'll be receiving to where they actually are allocated to specific funding programs, like your overhead or this grant or another funding stream that you have, just to show that separation. And just a brief summary of why you don't have an audit. And if that's because we're starting up, we have a low budget, we'll absolutely work with you all to get that audit pushed through at a way that works for everybody and is financially feasible.
Yeah. Thank you, Courtney. And thank you for being here today. Courtney was on the slide up there, part of our fabulous grants and compliance team. Let's see. So some of these, let's see. Let's see. Drug checking equipment, like a spectrometer, could be considered overdose prevention. Vending machines would be allowable. Rapid testing kits. I might need more information about what type of tests. Do we mean fentanyl test strips or
Hi, this is Sandra in California, Santa Cruz County Public Health. I'm thinking about rapid tests for HIV and hepatitis C and maybe potentially STIs like syphilis, but mainly HIV and hep C.
Okay. We might need to double check the answers to that one in particular. I feel like we would encourage, if possible, more partnership with health departments, but again, that can be on our list of ones that we'll follow up with. Yes, participants sort of clothing or different types of comfort or sanitary items. Yep. Multiple harm reduction programs can apply together to build collective impact. Yes.
It looks like we have a couple of hands raised here.
Okay.
Do we want to go there?
Sure.
Eater, am I pronouncing that correctly? You can unmute yourself and ask your question?
Yeah, thank you, Eder. Thank you. Well, my question was going to be, so I work the harm reduction as a harm reduction coordinator for culturally specific for Hispanic Latinx community, and food seems to be very much a very cultural thing to building rapport. With food, like sometimes we may not have an event and it's just basic outreach. Would food be allowed to be used, or would the funding be allowed to be used for outreach?
Like distributing food to the people you're
correct. Yeah, we have
people you're doing outreach to.
Yeah, builds rapport. So okay.
Yes, I think, I mean, within reason of the overall request, absolutely. Yeah.
Eric, do you want to go ahead?
Yes, thank you. Can you hear me?
Yep.
Yeah.
So my question is, so Arkansas, according to just a brief dive, does not have a concurrence or determination of need currently. Is there any other pathway to apply for the funding or be eligible for the funding?
Well, you can apply for a determination of need, or a clarification around the determination of need is that this can be either city, county, or state. So say you have a program that's operating out of Little Rock or something of that sort, right? Like if there's an unwillingness at the state to, or like just not time at the state to apply for that, then thinking through like Texas and all those jurisdictions, like your city or county could also apply, and again, that process is it can be very straightforward, you know, and we are able to provide technical assistance on that through the National Harm Reduction TA Center. I've helped a lot of jurisdictions over the years get those in place. Let's see.
Ryan?
I'm
Yeah.
sorry, so for clarity, we would not be eligible until we have the concurrence of determination of need, either
Correct.
through the state, the local, or county entity.
Correct.
Okay, thank you.
Yes, underlining the importance of reaching out to the TA Center to get assistance with any of that. Always glad to help.
I'm sorry, just for quick clarification, in California, you just have to be a state approved syringe exchange program?
Mhm.
Oh, okay. So you don't have to have anything. You don't have to be
California absolutely has a determination of need. There's only a handful of states, about 8 or 11, 10 that currently don't have the determination of need. So there was a link posted in the chat, which we can post again to double check if your jurisdiction has it or not. And it gives some details about process. And again, if we want to go actually to the next slide with the contact information for both the our drug user health TA email, as well as the you know, the Q&A box for this. That would be good. Whew. Let's see, so can the money be used towards improving the physical office space, small renovations? Yes, so certainly outfitting an office or mobile unit is possible. And Connecticut, you are absolutely eligible for applying, Jean.
Can we go to Ryan Edgerton?
Good afternoon. So we want to apply for this funding, and we found out today that a partner of ours wants to apply for this funding, but then subcontract. Could we submit 2 applications, or does it have to be 1?
There's no barrier to you submitting 2.
Okay, thank you.
And next we have Jancy Archer.
Thank you. I'm just wondering about sustainability. So if a program expands and then funding is over, is there support for continuing sustainability, or is there a requirement for making a plan for continuing services after funding is done?
Yeah, well, so again, this is a 5-year cooperative agreement with anticipated 2 years for the first selected, you know, cohort of folks who are going to be funded. So we can promise, you know, that so long as, you know, y'all are doing what you're saying you're doing, and, you know, using the money and all of that. And then after the 2nd year, we would recompete for, you know, kind of a broader, and folks can recompete and reapply. And then again, if we receive additional funds in year 2, like more than what we were able to put out in year 1, then we will be able to open up another RFP application process for additional programs to be funded. And that's pretty much how we're approaching strategy on this. And, you know, I think some of the ways we've been thinking about having sort of monthly, like, touch points, brief touch points about how things are going, how sustainability is, you know, like, that's definitely a topic that, you know, our team, the vocal team, you know, some of your contacts there can really help work through. And also we can share strategies from other some other, you know, projects that we've worked on about how we can also work with the University of Washington evaluation team to really help package the data and the importance of these resources, and, you know, in terms of getting increased, or, you know, supporting your current outreach and project activities. So that's the thing we'd like to work on.
Thank you.
Yeah.
We have a question or a raised hand from Sarah Armbruster. Oh, you need to come off mute.
You mentioned the restriction in terms of medications, but I was wondering if there were restrictions in terms of medical supplies, like winter supplies.
Yeah, no, that's all allowable. The only restrictions in terms, there's a question about the medications, but there's also we have to follow what is federally allowable and written into the Appropriations Act. So that excludes like syringes and cookers and most likely pipes and stemware at this point. I say, yes, that's not, the pipes and stemware is not 100% prohibited yet, but we have a strong likelihood that it will be in the next continuing resolution. And yeah, Anita, I feel like I haven't read your full question, but this is certainly, this is a new day with federal partners, and it's, this is really a space for us to, again, really show just how incredibly important and central your programs are to people who use drugs in our communities and your communities. And I feel like every, for some other history, there have been a variety of organizations, NASDAQ included, who have been funded for some demonstration projects that really have helped to pave the way and build the case for how important SSPs are in delivering COVID vaccines and vaccination services, for increased patient navigation. And I think what's so special about where we are right now is we have, federal partners are, have created these opportunities for us to grant out, to award out to you all to do the work and bolster the work that you're already doing, and that is just a real acknowledgement and recognition that you all are doing incredible work.
I'm sorry, I do have a quick question. I wanted to double check. I don't know if you answered this already.
Alyssa, we'll get to you, but Gary Bright has had their hand raised, so I want to touch them and then we'll call on you.
Oh, okay. I wasn't sure if anybody answered my question yet. Sorry.
All right, and sorry I talk kind of slow. That's just me, but the question I had was about in the selection process, inclusion of people who use drugs at all levels. We definitely, I mean, we're a very conservative rural community in Ohio. We're housed in a health department, so we've looked at that issue of how do we actually hire people who use drugs. We definitely have 2 full-time staff who are people in recovery, so people with lived experience using drugs, just not, we don't really, I guess we don't really ask actually per se whether someone is using. We don't actually, we don't even test, to be honest, our staff. So but if we can, so it would be hard to really say, you know what I mean, whether I'm just trying to kind of think through how would we, like, we do have a group we call our harm reduction advisory group, which is like we invite participants from our syringe service to be part of that. And that, so like their feedback basically guides how we run the program. And I don't know, I'm just trying to think through like how, I don't know what the parameters are around that, how we would, with the words that are allowable in the application, like what we would really focus on there. Because we definitely have a commitment to doing that. I just don't know, like, if you're really particular about how we're doing that.
I mean, describe it in your application. We want to prioritize programs that meaningfully include and involve people who use drugs at all levels. And so that is a good thing for us. And so really, the more detail on that, the better. And I appreciate you structuring your programs like that.
Okay, and then if we could get back to Alyssa, I lost your little box on my screen, but who had a question before Gary.
Okay, I'm sorry. Could I ask my question?
Yeah.
Okay. I was like, hold on. I was like, we were looking for it. Okay. I was just curious about the 501c3 determination letter. May I ask why they are asking for that when applying?
Well, you will either need a fiscal sponsor or be couched within a public health organization or a community-based organization, like thinking through like an AIDS service organization or a federally qualified health center, which wouldn't necessarily need the 501c3, but they would need they have a different type of designation that would need to be there. And if you are independent and doing this work, then you need to find a fiscal sponsor.
Okay, well, we're actually a tribal organization.
Okay, great. There is a different designation dependent upon, we can help figure out what the actual, it wouldn't have to be a 501c3. There's a different type of, you would probably be closer to what would be like a federally qualified health center or something of that sort.
Yeah, we are a federally qualified health center.
That works.
Yes.
That works.
So we don't need to be sponsored by anybody and we don't need a 501c letter?
Correct.
Oh, okay.
There's a different type of identification like number
Okay.
that we can help we can help figure that out. Yeah.
Okay.
Alyssa, if you email duh-grants@nastad.org too with any additional questions on this, we can follow up with you to.
Okay. All right. I was just curious, like if we needed one of those, but all right, you answered my question. Thank you.
Real quick to touch on a question in the chat from Jesse Martin, whether you can use the funds for the cost of hepatitis vaccines for SSP clients. That's also going to be in the list of questions that we'll follow up on regarding medication purchases and whether that's allowable. I see Caitlin Hall with their hand raised.
Hello, my question is, would purchasing like warm weather clothing like hats, gloves, scarves, and things like underwear be approved? We usually have trouble purchasing those kinds of items.
They're not unallowable.
Awesome.
So long as it's within reason in terms of, like just make sure you're framing it, like the need in your application, because I think that's a very common human need. I live in New Orleans and I'm cold all the time. So
awesome. That's really great to hear. Thank you.
Of course. And I did see a couple questions, one from Katie about is the 50 to 100,000 for the year one or spread over the 2 years. That is what is being awarded in year one. The year two funds are dependent, are more could be variable based on what is allocated, given to us to give out into community, and that is based on sort of appropriations. So there might be variation in year two, but the 50 to 100K that we're talking about now is for just the year one. And no, there is no program income cap. Ryan, do you want to speak up? I'm now paying attention to the hands.
Yes. Is there a cap on indirect costs, or are there no indirect costs allowed?
There are indirect costs allowed, and there are if you have an approved NICRA, like indirect cost rate, then you should be good with whatever that is. If you do not have an approved NICRA, then there is a thing that is called, my social work brain is not going to tell me, a
de minimis rate.
De minimis. That is, Courtney, if you don't mind, 10%, 11%?
Yes, it's 10%, up to 10% now. You can elect to take less. I don't know why you would, but I would definitely, if you do not have a federally negotiated rate, take the 10% indirect cost rate.
Okay, thank you very much.
Yeah. Whew. I feel like we got through a lot today. Others? Things that we've missed? Okay, Marissa, what's your question?
Hi, thank you. I could not figure out how to raise my hand for some reason. Yeah, I'm wondering about the, what do you call it? The financial policies and procedures required document. Just like what that should look like, what format, like, is it like, a kind of like a single page, or is it like longer. I don't think we currently have one of those, so we'll be creating one.
Okay. Well, just a note, oh, hi Birdie, okay. Just a note that there are some examples of some of these in the resources section of the Harm Reduction Hacks website to give you an idea. This is actually, I mean, part of what would be sort of like your organizational policies and procedures, specifically related to how you keep track of timesheets, how you keep track of billing and not billing, you know, different types of like what is the Birdie, the bird dog, yes, is very impatient, but and so we can certainly provide and direct you towards some examples of those. And yes, all of these live links on the NASDAQ landing page for this funding opportunity, and we're glad to, if you want to reach out to one of these emails there, feel free, and we can point you more specifically towards some lovely programs who have shared some of theirs in the past.
Is Intuit QuickBooks ideal?
Yeah, QuickBooks is great. It's really just about like sort of like whose responsibilities are whose related to that type of thing, like who's responsible for signing timesheets, what are those processes, what is, you know, who's responsible for maintenance of different types of, you know, the different potential funding sources you all have. How do you keep those things, just policies around how to keep all those things straight. And yes, we definitely have good examples that we can share.
We
Oh, that'd
have
be great. Thank you.
one last hand in the raised, Eve Lyon, and it is 5 o'clock Eastern, 4 o'clock Central. So I know that this might
Hi.
be last one.
I'll be real quick. I'm in Florida. Hello, everybody. And unfortunately, I came in a bit late. I had a hard time connecting. Can you just review the timeline for how this is going to roll out?
Sure. So the RFP with the link that was just put in into the chat there, the RFP was made live and announced to community last Tuesday. So that was the 29th. And then we are hoping for, well, we are aiming for applications to be due January 20th, trying to give as much space as possible given the holidays, and expecting notification to be mid-February, and potential start date aiming for March 1. And that's all outlined in the RFP at a couple different places, including, you know, instructions around the budget period that you should, you know, include that type of thing is all in the RFP. So.
Okay, so the reason I asked about timeline is because you said it seems like there are some unanswered questions. So people should hold off until those questions get answered, or go ahead and apply and then.
I would go ahead and start your application, fill out the parts that you can. We will get answers for the few and post those, any questions that we will post a Q&A that came up here and others on the landing page on a weekly basis. That's our plan. So you can kind of keep checking back to see if that's been answered. And if it hasn't been answered specifically, reach out to us more directly with the contact information that we provided at the end. And I think slides in this recording will be able to be posted, if not by the end of the day tomorrow, early on Monday.
Excellent.
Cool. Glad you're here. Whew. Q&A is always rapid fire.
I'm sorry, one quick question. I'm sure you probably answered this already, but how can I get a copy of this slide?
So we are going to have
PowerPoint?
these slides and the recording posted to the NASDAQ landing page, which has been dropped in the chat a couple of times. Thank you, Allison. And so those will be posted within, hopefully by the end of the day tomorrow, but given that it's so late today, it might be Monday. Cool.
Thank you, got it now.
Of course. Well, I just want to reiterate appreciation for our lovely project partners, our team who've worked just tirelessly to get this out in community, but extra appreciation for all of you joining us here today and sharing space today. I'm really excited to be in a place where we are able to get, really solid resources into community and into syringe services programs. Y'all are doing the work, and we're just like one little piece of hopefully making that a little more well supported. And so, yeah, excited to see applications as they come in, and really don't hesitate to ask, through this email, through the TA center. We are really excited to be here and in this space and sharing space with you. So I hope everyone has a lovely afternoon, sort of night, and yeah, we're here if you need us, so don't hesitate to ask. Really exciting times. So thanks, everyone. I think we're done.